Hello, today we are going to share about anemia in pregnant mothers. The editor of the video is Nur Aida binti Dabo and Nur Sofia binti Sulaiman. I hope you guys enjoy the video. Anemia. What is anemia? According to World Health Organization, anemia is a condition of insufficient red blood cells to carry oxygen to meet the physiologic needs. Almost 1.62 billion people get affected around the world, which the most affected is children, followed by the pregnant mothers. There are few factors can cause anemia, including education level, socio-economic status, and nutritional status. How to diagnose anemia? Anemia can be diagnosed by complete blood count, which is an automated instrument that measures mean cell volume (MCV) and mean corpuscular concentration (MCHC). Mean cell volume is a cell size that can be either small or known as microcytic or large size known as macrocytic. While mean corpuscular concentration is the hemoglobin concentration that can be small in scale or normal in amount and normal in color. There are few symptoms experienced by anemic person like pale skin, fatigue, shortness of breath, dizziness, and also cold hands, but the symptom depends on the type of anemia.
Now I will be explaining about the nutrition program planning using the design methods. Design methods is an acronym that stands for D. Deciding behavior, E. Explore determinants, S. Select theory, I. Identify objectives, G. Generate plan, and N. Nail down evaluation plan. The first step is deciding behavior. Our targeted audience are pregnant mothers, but we narrow it down to pregnant teens and teenagers at reproductive age, which is 15 years old. And the issues or problems that need to be solved is anemia pregnancy. The second step is explore determinants. In anemic pregnancy among teenagers, the determinant is that early pregnancy, especially teenagers, is a taboo in the Malaysian society, thus teen mothers would feel ashamed to seek for treatments. Next, late antenatal booking and low visits to the antenatal clinics by pregnant teenagers at later gestational age explain that teenagers who are pregnant are unaware of the importance of early care of pregnancy. The third determinant is food intake, in which pregnant mothers might consume less iron than the recommendation, or maybe consuming substances that inhibit iron absorption excessively, such as calcium. And lastly, the reason that anemic pregnancy occurs among teenagers is they are physically, mentally, and financially unstable due to smaller body figure, having to think about the baby at a very young age, and for not having jobs, making them having low preparation for pregnancy at early age. The third step is select theory. In planning nutrition program for combating anemic pregnancy, we have choose two theories. The first theory is social cognitive. This theory has guided us into encouraging the pregnant teenagers through educational programs so that it will increase their motivation to change their behavior towards a healthier pregnancy. The second theory that we have selected is self-determination theory. This theory has guided us on how to make the teenage mother become more motivational to start a change for themselves. In this theory, we focus on the benefits of behavior changes for the mother and also the child, a better understanding on the importance of early antenatal care, and to manage and control the incidence of anemia would help the pregnant mothers to have a better self-determination. For the fourth step, identifying objectives, we have chosen 4 mediators in identifying our objectives, which are education, action goal setting skills, self-regulation skills, and autonomous motivation. The objective on the aspect of education is that we hope that we could educate teenage mothers about the importance of taking iron-rich food to get early antenatal care and to spread the awareness about the available treatments to treat anemia during pregnancy. Next, action goal setting skills. We hope that pregnant teenagers can create their own personal plan to avoid anemia. The third mediators, which is self-regulation skills, we aim that teenage mothers supervise their health condition by using their antenatal and pregnancy cards to always go for regular antenatal checkup. And the last objective is that we aim that pregnant mothers will have their own personal desire of having pregnancy experience. The fifth step of the design method is to generate plans. And in combating anemia among pregnant teenagers, we have decided to make an anemia during pregnancy awareness day at schools or educational institutes. This program could be held for a few days and various activities could be implemented, such as counseling sessions, talks from doctors or health physicians about the effects of anemia during pregnancy, demonstration of preparing food high in iron, and the attendance of health staff to explain about the antenatal care. The last step in the design procedure is the N, which stands for Nail Down Evaluation Plan. In this step, there will be 3 aspects that will be taken to evaluate the outcomes of the program that we have planned. The 3 aspects that we choose to become the indicators for the outcomes are the 4 mediators, behavior changes, and health states of the pregnant teenage mother. The tools to indicate the outcomes of 4 mediators is by having survey on how the mothers are doing. Next, to indicate the outcome of the behavior, which are regular visits to antenatal clinics and to consume enough iron to avoid or reduce the incidence of anemia. The tools that we are going to use is also by having surveys. And lastly, the health outcomes of teenagers will be indicated by the anemic or non-anemic status, and the tools for the indicator is the hemoglobin level in the pregnant teenage mother.
Ministry of Health Malaysia has developed few strategies in treating anemia. First, management of anemia according to model of good care. Second, display checklist of anemia in front of antenatal care and health education. And the last one is increase the effectiveness in dealing with anemia. Based on model of good care, anemic mother should go through few steps. The anemic mother needs to attend to the nearest clinic for registration. During registration, the past history and current condition will be recorded. The next section is anthropometry and general examination. Height, weight will be measured during this section, including blood pressure and pulse. While in lab examination, blood and urine will be tested. Next is physical examination. During the examination, thyroid, tongue, abdomen will be examined to know the mother's condition and also the baby's condition. And then the nurse will be share some information about health with the mother. The information are like healthy food intake, anemia complication, during pregnancy, even cooking demonstration we will carry out at the clinic. All the mothers need to examine by the doctor for further investigation, and the treatment will be given based on the need. And the anemic mother will be given with hematinic for the primary treatment. Also, the doctor will be come to home for a home visit for supervision of the meal, social and environment of the mothers. And when the case is become severe, it need to be referred to the nearest hospital. Another government effort in treating anemia is display the checklist of anemia in front of antenatal card so it is easier for the nurses to determine the anemic mothers. Next, organizing health education during premarital course and parenting programs, and also display poster and pamphlet about cantik bersuri tanpa anemia at the clinic desk. Ministry of Health Malaysia improved the services by discovering new interventions known as anemia days for the nurses. The intervention is to increase the effectiveness in reducing anemia. It helped the nurses in dealing with anemia among the pregnant mothers. This also provides information about classification, symptoms, complications, health education for treating anemia.
In conclusion, the prevalence of anemic pregnancy is still high, including the teen mothers, but the prevalence of anemic pregnant teenage cannot be observed due to limited studies about the prevalence of anemic pregnant teens. A lot of intervention that has been done by the Ministry of Health to reduce anemia in pregnant women. The most common intervention is the iron supplementation, improving knowledge, skills, and behavior of health staffs, and monthly checkup at government clinics. And that's all from us. Thank you.